The team working on the Connected Health Cities programme is quite large and brings together University of Liverpool, Lancaster and Ames Grid Services. And Ames Grid Services have done a really great job of building something called a data arc, which is a really secure place to store data, even though it's anonymous. It needs to be in a secure place. And having created that environment, we now have analysts that can tunnel into that arc and analyse the data. And the data that we have are what's sometimes called administrative data. So it's the data that the health service collects and shows to NHS England and others so that it can be paid for the things that it does. So it's information about people's diagnoses and the sorts of treatments and care that the health service has provided for them. So one of the first things that we need to be able to do is to identify the patient populations that we're interested in. So, for example, we're interested in people with alcohol-related liver disease. We need to be able to identify those people in the data set, and that's not at all straightforward. You would imagine naively that there was just a single code and people with alcohol-related liver disease were coded in that way, but it's not the case. There's a whole range of different codes that can be used, and so one of the big tasks is to build the algorithms that can help you identify the patients that you need. And we've built algorithms to identify people with alcohol-related liver disease, people with epilepsy, and people with chronic obstructive pulmonary disease. Having built those algorithms, we can then work out how many people there are with that problem, how often they're going to hospital, how long their stay is, what the mortality is, whether they get readmitted within 30 days, all those sorts of things which are really helpful for the health service to know to plan its service. Yeah. So the best model of that we've looked at is around the epilepsy pathway. So we were able to see from the national audit and from analysis of these routine data that we've got a disconnection between the emergency department and the neurology or epilepsy services. So people were going to the emergency departments with the seizures, but they weren't getting put on a pathway that got them to see somebody with expertise in the problem in the neurology service. So we were able to implement a pathway and use these routine data to tell us whether that pathway was making a difference. And what we find is that the pathway makes a difference. It's smaller than we would like. If we employ a nurse to try and make sure the pathway works, it works even better, but it's still not good enough. So we can take the learning from that to then make further changes and assess the impact of those changes in the same way to work out whether we're heading in the right direction. And it's a really good example of how we might create a learning healthcare system whereby we make a change, we analyse the data, and based on the results make further changes and slowly and incrementally move to a better performing healthcare service. So with the seizure pathway, we were trying to do something really simple, which was about just trying to make sure that after presenting acutely, the person gets to the right place at the right time. So what we've shown is that people are more likely to get to the right place at the right time with a pathway in place. But we've got more work to do to make that happen for everybody. And that's almost certainly the case across the health service. And I'm sure that there are lots of things we can do to make the service more efficient and accessible to patients. So we're really on a journey, and the Connected Health Cities programme is just a small part of that journey, and it's focusing on analysing data. But clearly the data is coming from really quite a complex health service with quite a complex digital architecture, and it's really important that we get our act together to make sure that we have IT systems that are functioning well, work well for clinicians and patients so that healthcare improves, but also the data are collected seamlessly that allow us to work out whether our health service is working well or not. And embarrassingly, the health service has not been that good at doing that in the past, and we really need to put the systems in place to make sure that we thoroughly assess the output of our care.